Hello and welcome to Legislative Report. I'm State Representative Jason Ortitay of the 46th District in Allegheny and Washington counties. When someone mentions the drug problem or drug abuse, you may think of heroin or cocaine addiction, but more and more people are becoming addicted to medicines originally prescribed by a doctor for a legitimate purpose. The misuse of prescription drugs can lead to addiction and often to the use of illegal drugs, taking the lives of those caught up in this cycle. This problem is an epidemic both in Pennsylvania and across the country and affects people from all walks of life. Joining me today to discuss prescription drug abuse in our area is Gary Tennis, Secretary of Pennsylvania Department of Drug and Alcohol Programs. Secretary, welcome to the program.
Good to see you, Jason.
I'm glad you could be here. I know back home this is a very hot topic and something that a lot of people back home are looking forward to listening to and getting your insights on. So just want to start briefly, if you could give me kind of some introductory information about yourself.
Well, I came to this from actually I was a school teacher originally in Pittsburgh, but I went to law school, came out and joined the Philadelphia District Attorney's Office and worked in that office for 26 years. The last 20 years I worked on state legislation to basically make our communities safer from crime. In 1992, I was appointed by the old Bush, President Bush, George H.W. Bush, as Executive Director for the President's Commission on Model State Drug Laws, but we actually ran under President Clinton and got really very, very in-depth familiar with all the aspects of the drug and alcohol issue in that work. And it became clear from that work that the smartest way to increase public safety and to reduce crime in our communities is to make sure we take care of people that are suffering with addiction. If we do that, we can have, in addition to all the other benefits, we can have safer streets.
And that's a good point. How long have you been serving as secretary?
Well, I was appointed under Governor Corbett, and I actually initially came in January 2012, but was getting the department ready. So we started July 1st, 2012. I'm now coming up on ending the fourth year, starting the fifth year. So I was honored to be reappointed by Governor Wolf when he began. So it's been about 4 years.
Well, that's good. Well, congratulations. I'm happy to have you here. And
I'm happy to be here.
Well, one of the questions I always get asked back home is, what is the state doing to address the drug problem back home?
Well,
and those are one of the things, and I'll leave it very open-ended for you just to discuss, because there's a lot of different things going on.
And there is. We've got a whole lot, and Governor Wolf has made this, as everyone knows, from the roundtables and all the other initiatives, this is a very, very top priority, and it's one that I think everybody's setting politics aside on, and it's not a Republican or Democrat issue, as you know. We're all, first and foremost, we're all Pennsylvanians and Americans, and we're all fighting together on this, as we would almost as if a foreign invader attacked. We are in the middle of the worst heroin, all overdoses. We're in the middle of the worst overdose crisis in the history of all recorded history, not just the history of the country, but any time ever. We know we're vulnerable to that because the funding, according to for drug and alcohol treatment and prevention, according to the federal government, is nationally at about 10%. Pennsylvania, we do a little better. It's maybe 14, 15% of what's actually needed. So that leaves us vulnerable to these rolling epidemics that somebody my age has seen over and over again, sometimes once with methamphetamine, crack cocaine, heroin back in the late 60s and early 70s. This particular epidemic began with the just tremendous ramping up of prescribing of opioids. The pharmaceutical industry basically launched a PR campaign back in the 90s saying that we should be eliminating all pain. You may remember pain got listed as one of the 5 vital signs, healthcare vital signs, to measure your quality of the care you're providing. The statement was made that the risk of addiction was overstated and exaggerated, and the prescribing of prescription opioids quadrupled across the nation. So even though we might be just a few percent of the world's population, in America we consume 80% of the prescription opioids that are produced on the whole planet. We are awash in prescription opioids, and that is really the cause of this crisis. So we are working on this on a number of fronts. It's really a multifaceted operation. So getting back to root causes, we're working very, very hard with our medical community to stop the overprescribing of opioids and to have safer, more effective practices. We actually began back in, I think it was 2014, we began pulling together major healthcare systems from across the state to take a look at pain prescribing and to develop the guidelines to rely on other to go to other mechanisms for treating pain, things like physical therapy. There are other medicines that are not addictive, like the lidocaine and some of the kind of the Novocaine related medicines, electronic stimulation units, cognitive behavioral therapy. There are chiropractic. There are any other number of ways to deal with the root causes of pain and to reduce the overprescribing.
I want to ask you a question about the pharmacy industry. Back in the 90s, as you were talking about, we're one of the only countries in the world that actually allow advertising of prescription drugs on TV.
I know.
What are your thoughts on that?
Well,
is that a contributing factor to this in some aspects?
It certainly has to. I mean, they're designed to increase the pressure on a physician or healthcare providers go through enormous amounts of schooling and practice through their residencies and other requirements to make sure that they know what's best for their patient. So now they're designed for this. Now they're dealing with patients who are putting pressure on them and are probably measuring their performance to prescribe particular medicines. You know, consumers who don't really have any training in the area, but they've seen the 30-second commercial and they think, well, that's what I need. So I think it does put pressure on them to do things that they might not otherwise really think is in the best interest of the patient. So, I mean, I think it's a little bit troublesome.
Okay, it's a conversation I have back home with a lot of people, and they ask about that too. And it's like, okay, well, I know I think Australia is the other one. I think there's only like one or two, but it's just a relevant issue. But in getting back to the original question we were talking about,
so what are we doing?
What are we doing?
So we're working. So we've done. In 2014, we did 3 sets of prescribing guidelines. We did them for use of opioids in the treatment of chronic non-cancer pain. So someone coming in with a herniated discs or hurt shoulder or whatever that's just hurting all the time, or arthritis, trying to scale that back. Then in July of 2014, we promulgated the prescribing guidelines from emergency departments to reduce the prescribing out of there. We knew dentists were overprescribing. So they were sending people home after routine dental work with opioids, which is really bizarre because they're not very effective for dental pain. You need an anti-inflammatory for dental pain. In December of 2014, we had the dental pain prescribing guidelines. Dr. Rachel Levine, the physician general, when Governor Wolf came in, I actually asked her if she would take it over because it's really more appropriate for the physician general to run this rather than a former prosecutor out of Philadelphia. And she has done a beautiful job and done 3 sets of prescribing guidelines, one for OBGYNs. We had OBGYNs in some areas that were sending women home with opioids just for the routine aches and pains of pregnancy. And this is while the baby's brain is developing. Or sending them home after routine deliveries with opioids, and the opioids pass through the mother's milk to that baby's brain. So those guidelines have been promulgated now to sort of show what the safe and effective practices are there. We've done them for geriatric because we have actually a lot of overdoses with some of our grandparents or older Pennsylvanians who get confused about, they've taken the opioids cloud the mind, and they take them 2-3 times, forgetting they already took them, and then they sometimes die. So we've got geriatric guidelines, then we've got them for dispensers, and now we're moving on to new sets of guidelines. We're going to do 3 more sets under Dr. Levine's leadership and Governor Wolf's leadership in 2016. So that's one angle. We have a prescription monitoring program that allows doctors, and you voted for this bill, yes. Thank you, that allows doctors to it enables them to see what the patients have been doing. Have they been to 4 other doctors getting opioids, which indicates that they have a substance use disorder?
Yeah, we've seen that. We've seen people go take the same script over and over to different pharmacies. That's another big issue.
So we can put a stop to that, and we're really trying to focus on intervention. We don't want a situation where the doctor just throws the person out of the office. We want that to be an opportunity to intervene with somebody who has a substance use disorder and get them to the help they need. By the way, we're the 49th state to get a true prescription monitoring program. In the other 48 states, when they've been implemented, they've forgotten the intervention and referral to treatment piece. And as a result, there's been a huge uptick in heroin when the prescription monitoring program went into place. People who are cut off from their prescription opioids end up going to the street. They're either unavailable or they're very expensive, the prescription opioids on the street. The heroin is very cheap and very powerful. So we want to try to mitigate that uptick as much as possible by training our healthcare providers when they spot somebody with the prescription monitoring program to say, you don't need more pain medicine, you don't need more opioids, you need treatment, and we're going to get you the help you need. That is the smart way. Do you know that 4 out of 5 people on heroin today started with prescription opioids? So that's where this problem traces back right now. So that's another big issue. We're also doing continuing medical education credits. We're working with a medical society. We've got 4 different ones. I won't go into the details, but I could lay them out for you if you want. But all aspects of this, to raise the quality of practice. On the back end, so now we have, I said we have the highest overdose rate. We had last count, we had just under 2,500 Pennsylvanians die of overdoses. Nationally, 47,000 Americans dying of overdoses at last count in 2014. We're likely to lose more Americans to overdose this year than we lost in the entire 12 years of the Vietnam War, which is something I grew up with. It's really a terrible crisis. So we have worked hard. We've called all of the major healthcare providers in the state and asked for contributions to purchase naloxone for police officers. And police officers in Washington County particularly, they've done a really, really nice job, and with your district attorney, Gene Vitone's leadership, and I know you've helped out with this too, to get this into the hands of police officers. Lest there be any question about, well, why would police officers have it? Over 1,000 times, police officers have saved lives under this program. And we're going to be doing something on that in the next couple of days to honor them for what they've done. We still have many more police departments that need to carry naloxone because we need to save lives, but it's not enough to save the life. Once we've saved their lives, we've got to make sure that they get to the emergency department, and once they're stabilized, they need to go from there to treatment. And we've worked on that as well. We've done warm handoff regulations to really wrap around strong interventions on those overdose survivors to get them to treatment. Out in your neck of the woods, Washington County, Cheryl Andrews has a program that she's developing with your county commissioners and your district attorney, where they're going to take case managers, and when an overdose is called in, they're going to have a case manager go right out to the overdose scene and start engaging that individual to make sure they get into the ambulance, they go to the emergency department, and to make sure from the emergency department they get to treatment. We've got to get them into recovery because they'll be at risk of overdosing again if we don't.
Right, and that's one of the conversations that I've had with a lot of the local police officers. A lot of times they're the first ones on the scene, and they're the ones administering it. And when people come out, people don't realize that they come out swinging sometimes, and they said that was their biggest fear, was dealing with that and then trying to get them into a place where they could actually get help so they don't have to keep going back to the same place over and over again.
Yeah, and with the nasal spray naloxone, there aren't very many. The individuals may come out agitated or annoyed. They're not usually grateful at the beginning. They've been through an extremely unpleasant experience. This is not a fun thing to have happen to. You're basically doing several days of detox in about 30 seconds. So this is not the greatest thing. So we're actually not getting too many reports of actual violent conduct on the part. I think that's probably something that was more with when they were putting the needle in them.
Yeah.
Like what was, I can't remember the name of the movie where that occurred, but.
Oh gosh. I know there was a Sherlock Holmes movie where he did the adrenaline shot.
Yes. Well, that's actually somewhat overstated, and of course our police officers are very, very capable of handling any of that. But we do need to get them to treatment because most people who die of overdoses have overdosed before. So we need to take that opportunity to intervene, and that's something we actually have directed all of our county drug and alcohol directors as a condition of getting the block grant dollars that we send out to them, that they work closely with their emergency rooms to make sure they get to treatment. So that's another item we're doing. Jason, I could go on forever, but a big change in government occurred when Governor Wolf expanded Medicaid. That Medicaid in Pennsylvania has a very robust benefit to cover all levels of drug and alcohol treatment under Act 152. It covers whatever level of treatment you need clinically. And Medicaid expansion, which has right now 100% federal match, it'll be a 90% federal match, does pay for treatment. So that's expanded the number of people able to get treatment. A lot of our work is in building the treatment infrastructure and trying again to bring in more resources so that we can get people into recovery.
And that's the important aspect of it. What can people do at home to kind of help with the problem? I know we've seen the prescription drug off, like the unwanted medication at the drop-offs at the police stations.
Thank you for mentioning
Are
that.
things like that popping up more? Are you guys doing more of that?
We are, and we've gotten. I think we actually sent you a communication about that recently. We have drop boxes in I think all but 6 or 7 counties now. We were able to. When I first got this job back in, I think it was in fall of 2012, I was down in Bucks County and got a look at what they were doing. They were putting these prescription drug take-back boxes and putting them in the police stations, which is what's required by DEA regulations. We were able to get, actually Pennsylvania Commission on Crime and Delinquency had $100,000 available, and we've been placing them in police departments all over the state. Now originally when we did this, the DEA would come by every 6 months and clean them out. They were overwhelmed by the amount, and they basically said, we can't do this anymore. The Pennsylvania National Guard stepped up. We met with them and asked them, and they agreed to haul these away. So the Attorney General's Office, Bureau of Narcotics Investigation, works with the Pennsylvania National Guard to empty these boxes. The critical thing is, and I can't remember, I believe we've gotten 50 or 60,000 pounds of prescription drugs now that we've collected.
Yeah, I remember seeing the number. I knew it was really high.
It was really, it's in that neighborhood. These are drugs that, not properly disposed of, could end up in the bodies of our adolescents. Many of our beloved sons and daughters get involved in this when they're taken out of medicine cabinets. You know, somebody gets overprescribed Vicodin or Oxycontin. They keep them in the medicine cabinet for a rainy day. Today, that is no longer a safe or responsible practice. You're putting our young people's lives in jeopardy. You need to get rid of them.
That's one of the things that I hear back home. The kids are bringing these pills to classrooms in schools, calling them Skittle Parties, because they're grabbing pills out of their parents' medicine cabinets. And if it's one thing I can suggest to the parents back home, if you have medication, lock it up, put it somewhere so that your kids don't have easy access to it. Because I can't tell you how many times I've heard this, especially with the school districts back home in my home.
Well, Jason, and that's actually happening all over the state and all over the nation. So some of our overdoses are some kid who's doing this for the first time in their life. And you know, they think these are safe because a doctor prescribed them after all, so they couldn't be that bad.
Yeah.
And in fact, they can kill you. So it's absolutely critical. What you're saying, I just want to underscore, it is absolutely critical for anybody. Get those drugs. You can go onto our website. It's ddap.pa.gov, and there's a link there for take-back boxes. You can put in your zip code, and it'll tell you where the nearest one. Washington County has a very good. You got them in almost all of your police departments, so anybody can get them, take them there. If you flush them down the toilet, the water filtration systems don't really clean out those drugs, so we're all going to get a little of them if you do that. It's better to take them back, and don't waste any time. You know, it's our kids' lives at stake, and you know, kids engage in risky behavior. We want them to survive those years and enter adulthood and go on with good, rich lives. We don't want them dying because of a adolescent mistake. And so it's our responsibility as responsible adults and responsible citizens to clear out those unused medicines right away, as soon as we're done with them, and take them to a take-back box.
I know a lot of the local Rotaries have stepped up and sponsored some of these drop boxes at the police station. So I want to thank them too, and hope they'll have continued support of this project as we move forward.
They've been great.
Yeah. One of the others, a couple more topics I want to cover before we finish here. Earlier this year, medical marijuana was signed into law, right. And I wanted to get your thoughts on that, and if that could possibly help with the opioid issue we see today, or if just want to get your thoughts on that.
Well, I think, you know, that's a complex question, and the answer is
it is.
nuanced. And it really relates to the implementation. I think there's no question. I think you were here when the parents were bringing around these young children with Dravet syndrome, that childhood epilepsy.
I was. I actually had a child in my office, have a
So
seizure
you saw.
there. Yeah.
And how could anybody with a heart deny those parents the opportunity to use something that there are reports of success with? So that's just critical. I mean, I think really the devil's sort of in the details of the implementation. And one thing I think you can count on with the Wolf administration and Secretary Karen Murphy is that this will be implemented with fidelity. What we don't want to see is a situation like that's occurred in California where it's really listed as medical marijuana, but in fact it's kind of wink wink prescribed very, very liberally and really used recreationally. And I think everybody kind of knows that didn't work out so well. But if it's really managed with integrity, and I know that this administration will do that, I'm confident that I know Secretary Murphy is extremely principled about making sure these things are done right, and it's really properly used as medicine, then I think that there's really real potential benefit, and there are certainly reports of it being used effectively to help manage pain. So given what's been going on with the prescribing of opioids, I think we need to be really looking at all avenues.
Yeah, I had a constituent back home who has gone through cancer, still has it, and she's been asking me time and time again when she's going to be able to have access to it. I believe that children have the first access to it, I think starting next month, is what I heard preliminarily. And I think it'll be a help for the kids who might have cancer as well. And I mean, particular in this woman's situation, she said that it really kept her appetite up as she was going through chemo.
I've heard that as well. And people, they're going through a life-threatening illness. There's no good reason they shouldn't get the help they need.
Exactly. One of the last topics I wanted to cover, I've been doing a lot of research on this issue. Like I said, the drug epidemic has been a big problem back home, and I'm just trying to think of outside the box ideas and other ways to kind of address this, maybe in something new that we haven't done before. And I came to the Portugal model of what they did in 2001. And what Portugal did is they decriminalized small amounts of all of the illegal drugs. It's still illegal, but what they did is they took the small amounts and they basically said, okay, we're not going to throw you in prison anymore. What we're going to do is put you in front of a committee, and they're going to determine whether it's an administrative fine, you go to rehab, and you get I would say a court-appointed doctor to help you get through this. Right. And they've seen some effects of that where the overall drug use hasn't gone down, but the violent crime associated with it has. STDs have gone down, adolescent use has gone down. I mean, there's been some benefits to it. It's also freed up a lot of resources, I would say, for the prisons and for the police as well. But I just wanted to get your thoughts a little bit on that and kind of what you're thinking.
Sure. Well, I think the point you're driving at is that putting people in jail because they have a drug and alcohol addiction makes no sense whatsoever. They're not going to get better in jail. We're going to end up spending enormous amounts of money. We're going to have higher rates of crime than we need to have, and we need instead to be shifting the focus over to treatment and getting people better. So, I support the governor's position on the decriminalization. It's decriminalization, by the way, in contrast to legalization. So if it was legal, you wouldn't be able to bring them in front of that panel. So Portugal decriminalized it, and they treat drug and alcohol addiction like a healthcare problem instead of a crime problem. It makes no sense to be locking people up for this issue. We don't lock people up because they overate and got heart disease.
Right, and the stigma that goes along with that too makes it hard for these people when they do get out of prison to enter back into the workforce, get back into society. That's right. Because of the stigma attached to it.
So it's interesting, even back in 1992 when we did the President's Commission on Model State Drug Laws, I would say the most prominent, most important accomplishment we did was the Criminal Justice Treatment Act, and it really directed the criminal justice system to make sure they assess everybody for drug and alcohol problems, and that to the largest extent possible divert them to treatment and get them the help they need. If we get, everybody knows somebody in recovery. These are our best citizens walking amongst us. These are good people that are out doing good 12-step work. We want to get, that's what we need. We don't need somebody who's just going in and out of jail, in and out of prison. That's wasting our money. It leads to higher crime rates than we need to have, as you just discussed. And it leads to a lot of suffering. It's 1 out of 4 families are suffering with drug and alcohol addiction today.
And I think people don't realize that it's not just one demographic. You have as early as teenagers and kids into your 20s, 30s. I've seen people in their 60s leaving rehab centers for this problem. And it's not a white, black, it's not a race issue. It's across the board among different economic classes as well. I mean, it affects every single person.
It absolutely is, and it's been identified. It was actually identified back in colonial times. Dr. Benjamin Rush identified and said we need to stop. He didn't use the word stigma, which is what we would use today, but he said we need to stop looking at this as a moral failing and look at this as a disease that we should treat. That was 240 years ago. Now it's becoming more mainstream that we understand that this is a brain disease and that the brain actually is part of the body and we should be treating it when it gets sick too. We can get people better. We know that treatment works. Right now, today, we have 23 million Americans in solid recovery from drug and alcohol, from the disease of drug and alcohol addiction. Treatment works. So you invited me before we started the show to do any public service announcement I wanted to. So I wanted to do two. One is if you have somebody in your family, a loved one, suffering with drug and alcohol addiction, you can reach out. You can go to our website at ddap.pa.gov and there's a Get Help Now link on it. You can click on it. It will guide you both to treatment programs. You've got excellent programs in your district that are available to people in your district, or to your single county your county drug and alcohol directors, both Dr. Latika Davis Johnson in Allegheny County and Cheryl Andrews in Washington County. Get help for your loved one. This is a progressive, always fatal disease left untreated. The earlier you get treatment, the sooner you're going to get better, and the less better your outcomes are going to be, and the less it's going to cost all of us to get you better. So that's number one. Number two, if you have a loved one that's suffering with addiction to opioid, whether it's prescription opioids or heroin, or even someone who's just taking them on a regular basis, you should get naloxone. Naloxone is the overdose reversal drug. Can't be abused. It can't hurt you. All it does is reverse an opioid overdose. So Dr. Rachel Levine, the Physician General, signed a standing order for all 12.5 million Pennsylvanians. That order enables anybody to go into their drugstore and say, I'm using the Physician General standing order, get naloxone, have it on hand. All you do is spray it up somebody's nose, and they can go from being a person who's about to die to a person who gets another chance at life.
Well, that is great information. I just want to take this opportunity to say thank you for joining me today on this program.
My pleasure. Thank you for putting the spotlight on this. It's a critical issue right now.
I couldn't agree with you more, and we'll have you back soon.
Thank you so much.
Thank you.
All right, take care.
You too. That's all the time we have for this month's program. I'm State Representative Jason Ortitay. If you have any questions about what you've seen, or if I can help you with any state government matter, please contact me at my district office or through my website. That information will be on your screen in a moment. Thanks for watching, and please join me next time for Legislative Report.